Bismillahirrahmanirrahim. Yang berbahagia Datuk Alia Karen, Founding Chairperson of Yayasan Health on World. Yang berusaha Dr. Sangeeta Kaur, Organising Chairperson, the Board and Exco of Yayasan Health on World. Officials from the Ministry of Health Malaysia, esteemed speaker, panelists of doctors, community leaders, advocates, participants, ladies and gentlemen. Salam sejahtera and a very good morning to all. Firstly, I would like to express my thanks to YHOW for inviting me to officiate this Mental Health Experiential Conference with the theme Mental and Emotional Wellbeing in a Borderless World. I also wish to congratulate Yayasan World on Health, as I am made to understand that yesterday marks the 1-year anniversary of YHOW as a foundation. I'm pleased to know that Yayasan Health on World is equally committed in supporting the Ministry of Health in line with the United Nations agenda on the Sustainable Development Goals, or SDG 3, which is ensuring healthy lives and promoting well-being, including mental health for all. YHOW has taken efforts in advocating mental and emotional health as a global development priority, and not just for our fellow Malaysians, in which Ministry of Health is glad to be in collaboration with. This conference is timely as we in the Ministry of Health have been tirelessly advocating and establishing various platforms to assist the many Malaysians who were thrown off guard during the COVID-19 pandemic. Indeed, it's a noble act that Yayasan Health on World has jumped in to be a partner in addressing and assisting the ministry via the many initiatives, programs, workshops, counseling and coaching sessions done the last 1 year since its inception. In reality, each and every one of us, no matter how mentally and emotionally strong, may have faced the unprecedented wave of abnormality during the past 1 year. Many struggled to cope with constant changes, uncertainties, loss of jobs, deaths, financial and family distress, abuse, victimized violence, and some even faced poverty. Students were not spared either, having to face the new norm of online and homeschooling. The mental and emotional resilience was severely tested for many globally. Combined with our physical and emotional stability, good mental health helps build resilience. Resilience is an important component today as we continue to fight the pandemic and brave the uncertain times which lies ahead. The National and Health Mobility Survey conducted by the Ministry of Health in 2019 revealed that approximately 500,000 Malaysian individuals above 16 years of age and 424,000 children and adolescents suffered from mental health related problems. In addition, between January to December 2020, the Ministry of Health recorded 1,080 cases of self-harm admitted to MOH hospitals. Meanwhile, Police Raja Malaysia dropped another alarming and shocking statistics, revealing an increase in 2% in the number of suicide from 609 cases in 2019 to 631 cases in 2020. We are aware that many people have suffered in silence in fear of the stigma surrounding mental health conditions. The irony of it is, despite the various platforms, agencies and assistance made available, many choose to shy out, cave themselves in, and continue to suffer in silence. MOH has taken many initiatives to ensure access to mental health services. There are 1,161 MOH clinics, 4 mental health institutions, 62 hospitals and 28 community mental health centers, or Mentari, that provide mental health services that covers the scope of screening, early intervention, treatment and rehabilitation. The Ministry of Health has also established a psychosocial support helpline since the beginning of COVID-19 pandemic, in 2020 in strategic collaboration with non-governmental organizations, that is Mercy Malaysia. Our partners, Ministry of Women, Family and Development, Kementerian Pembangunan Wanita and Malaysian Islamic Development Department also provides helplines via Talian Kasih and Talian KSK Care. Other NGOs such as the Befrienders, Senham, Women's Aid Organization, MIASA followed suit with various assistance, and now even Yayasan Help on World has both counseling and psychosocial support lines. Ladies and gentlemen, we all know someone who has been affected by mental health problems, whether be it a family member, a colleague or a friend. We need more advocates to help those in need to seek and get the help they truly deserve. The help which are currently and readily available, however, despite available help, the high stigma towards mental health and mental illness may be a barrier in reaching out and seeking help. Employers will also need to play a more supportive role in the workplace, understand and empathize that many are anxious and distressed at work with uncertainties. Provide them the opportunity of all the channels made available today to seek help. Allow them a safe space to share. Talking to the right people helps. Today, I make the same plea to those who helm universities and schools. Our youth and kids have fallen into the trap of education anxiety, coping with homeschooling and online sessions. Many fresh graduates have had the rug pulled out from under as the unemployment rate rose last year with 4.8% as at November 2020. We as the fortunate ones, as advocates, as leaders of society, can and must reach out to assist in any way we can. For some associations and NGOs, funds are needed to continue their efforts. Recently, the government has allocated 24.6 million ringgit for mental health programs and initiatives. It's not a large sum, yet most developing countries allocate an average of just 1% of their GDP worldwide on mental health. We can all do better, as statistics reveal anxiety and depression alone cost the global economy of $1 trillion a year. Ladies and gentlemen, there is no health without mental health. Therefore, we need to acknowledge that true parity between physical and mental health, not just in our health systems, but elsewhere, as well as in our environment, schools, workplaces, and in our communities too. It's critical that we not only deliver parity of care between mental and physical health, but that of prevention too. We must turn our words into action. We must change the culture so those in need are not stigmatized. We must help and go beyond gender, age, race, creed, religion, and status, as mental illness does not choose any of these as a main target. So, I urge each and every one of you to start talking about mental health and mental health issues alongside with the Ministry of Health. Let's Talk Minda Sehat campaign. Together, we can break the taboo, we can break the stigma. Mental health, emotional resilience, and physical well-being should be part of our daily conversations and activities. I thank each and every one of you for stepping in together with Ministry of Health and Yayasan Help on World to make a difference out there, and wish each and every one of you the best of health. Remember that each and every one of us can do something for someone, no matter how small. What is insignificant to you is a gift for someone. Share that gift. With lafaz Bismillahirrahmanirrahim, I officiate the Mental Health Experiential Conference 2021. Thank you.